Good afternoon, everybody. I am going to go ahead and get started now on our Lunch and Learn for today. I'm going to go ahead and start sharing my screen for everybody to see. If everybody can hear me okay and see the presentation, please give a thumbs up reaction or just leave a message in the chat so that I know that we're ready to start. Awesome, thanks so much. So today we're going to be covering what I call the crisis, also known as the opioid crisis, and this is presented by the Office of Health Promotion. So, hello everybody. I would like to start off by saying that my name is Taylor and I work for the Office of Health Promotion as a health education specialist specializing in alcohol and other drugs. And for those who are unfamiliar with our office and what we do, in a nutshell, we proactively educate the SHSU community about health and well-being. Our office falls under the umbrella of the Student Health and Counseling Center. However, it's very important to note that we do not provide medical or mental health services. But some of the programs that we do provide include Elevate, which is SHSU's Healthy Campus Initiative for students, faculty, and staff. Cats for Recovery, which is our collegiate recovery program that provides social support and sober activities for students in recovery and their allies. Peer Health Ambassadors, which is our student leadership organization that works to promote wellness through fun and creative events. Program Requests, which is our outreach program that allows anyone on campus to request a staff member from our office to come and deliver a program or presentation to a class, meeting, event, or residence hall. Some of the signature events that we host every academic year that our office is well known for are our flu shot clinics, Fresh Check Day, health fairs, Wellness Week, and GYT, also known as Get Yourself Tested events. On the note of flu shot clinics, we will be offering flu shot clinics next week on the 6th, 7th, and 8th in the LSU Orange Ballroom from 9 a.m. to 3 p.m. Flu shots are free to all SHSU students with an active Bearcat 1 card. You will be required to wear a mask and practice social distancing. Temperature checks will also be performed, so please do not attend if you're feeling sick. I also believe that faculty and staff are available to get their flu shots on a limited basis on October 8th as well. And for more information about our office and upcoming events, you can visit our website at www.shsu.edu/OHP or follow us on our social medias at SHSU_OHP. Also, this semester, we are running our Wellness Rewards program. And to participate, all you need to do is attend one of our events and your name will be entered into a drawing for a Fitbit Versa. Please be sure to show your first and last name as your Zoom name in this presentation so that your name can be entered. You will receive one entry for each event you attend, and if you attend at least 3 events, you will automatically win a small prize. And today's Lunch and Learn will count as one of those events. So now we're going to get started on our topic. Opioids are derived from opium poppies, which is a plant that secretes opium when the outer bulb is cut, and it's made from synthetic derivatives. Opioids include opiates, which is an older term for drugs derived from the opium resin itself, such as morphine. Morphine was the first active ingredient isolated from a plant in 1803. The term opioid originated in the 1950s, and it combines opium and oid, meaning opiate-like. The definition of opioid was later refined to refer to substances that have morphine-like activities that are mediated by the activation of opioid receptors. Some medical uses of opioids can include pain relief, cough, and gastrointestinal issues. But an important side effect to note is euphoria, which causes a sense of wellness and stress relief. If you note on the PowerPoint, it shows you the chemical structures. The top is morphine and the bottom is actually heroin. The chemical structure of heroin is nearly identical to morphine, but with better brain penetration. So how do opioids affect the brain? Opioids bind to and activate opioid receptors on cells located in many areas of the brain, spinal cord, and other organs in the body, especially those that involve feelings of pain and pleasure. When opioids attach to these receptors, they block pain signals sent from the brain to the body and release large amounts of dopamine throughout the body. This release can strongly reinforce the act of taking the drug, making the user want to repeat the experience. Some common types of opioids include prescription opioids, heroin, and fentanyl. So prescription opioids can be used to treat moderate to severe pain and are often prescribed following surgery or injury or for health conditions such as cancer. In recent years, there has been a dramatic increase in the acceptance and use of prescription opioids for treatment of chronic non-cancer pain, such as back pain or osteoarthritis, and despite serious risks and the lack of evidence about their long-term effectiveness. More than 191 million opioid prescriptions were dispensed to American patients in 2017, with wide variation across the states. There is a wide variation of opioid prescription rates across the state, and healthcare providers are in the highest prescribing states of Alabama, which wrote almost 3 times as many of these prescriptions per person as those in the lowest prescribing state, which is Hawaii. Studies suggest that regional variation in use of prescription opioids cannot be explained by the underlying health status of the population. And some of the most common drugs involved in prescription opioid overdose include methadone, oxycodone, and hydrocodone. And to reverse this epidemic, we need to improve the way that we treat pain. So we must prevent abuse, addiction, and overdose before they even begin. Anyone who takes prescription opioids can become addicted to them. In fact, as many as 1 in 4 patients receiving long-term opioid therapy in a primary care setting struggles with an opioid addiction. Once addicted, it can be hard to stop. In 2016, more than 11.5 million Americans reported misusing prescription opioids in the past year. Taking too many prescription opioids can stop a person's breathing, leading to death. And oftentimes, prescription opioid overdose deaths often include benzos. Benzos are central nervous system depressants used to sedate, induce sleep, and prevent seizures and relieve anxiety. Examples of this include Xanax, Valium, and Ativan. Avoid taking benzos while taking prescription opioids whenever it is possible. Some side effects to using prescription opioids are that you might gain a higher tolerance, you'll gain a physical dependence on them, you have increased sensitivity to pain, constipation, nausea, sleepiness and dizziness, confusion, depression, low levels of testosterone, and itching and sweating. In addition to these serious risks, there's also a risk of addiction, abuse, and overdose. And so the next opioid we're going to talk about is heroin. Heroin use has increased sharply across the United States among men and women, most age groups, and all income levels. Some of the greatest increases occurred in demographic groups with historically low rates of heroin use, including women, people who are privately insured, and people with higher incomes. And not only are people using heroin, they're also using multiple other substances, including cocaine and prescription opioids. Nearly all people who use heroin also use at least one other drug. Heroin-involved overdose deaths have increased by nearly 5 times since 2010. And from 2017 to 2018, the heroin-involved overdose death rate decreased by 4%. And factors that may contribute to the decrease in heroin-involved deaths include fewer people initiating heroin use, shifts from a heroin-based market to a fentanyl-based market, and increased treatment provision for people using heroin, and expansion of naloxone access. So how harmful is heroin exactly? So it's illegal and highly addictive. It can cause slow and shallow breathing, coma, and death. It's often used with alcohol and other drugs, and that's especially dangerous because that increases the risk of overdose. And then when people inject heroin, they are at risk for serious long-term viral infections such as HIV, hepatitis C, and hepatitis B, and other bacterial infections of the skin, bloodstream, and the heart. So pharmaceutical fentanyl is a synthetic opioid pain reliever approved for treating severe pain that is typically used for advanced cancer pains. It is 50 to 100 times more potent than morphine, and it is prescribed in the form of transdermal patches or lozenges and can be diverted for misuse and abuse in the United States. However, most recent cases of fentanyl-related harm, overdose, and death in the U.S. are linked to illegally made fentanyl. It is sold through illegal drug markets for its heroin-like effect. It can be often mixed with heroin and or cocaine as a combination product, and sometimes that is with or without the user's knowledge to increase its euphoric effects. Reports from law enforcement indicate that much of the synthetic opioid overdose increase may be due to illegally or illicitly made fentanyl. And according to data from the National Forensic Laboratory Information System, confiscations or seizures of fentanyl increased by nearly 7-fold from 2012 to 2014. And there were 4,585 fentanyl confiscations in 2014. This suggests that the sharp rise in fentanyl-related deaths may be due to increased availability of illegally made non-pharmaceutical fentanyl and not prescribed fentanyl. So what exactly is the opioid crisis? It's the misuse and addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids like fentanyl. It's a serious national crisis that affects public health as well as social and economic welfare. The CDC estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the costs of healthcare, lost productivity, addiction treatment, and then criminal justice involvement. So we're going to talk about the history of the opioid crisis. So in 1775, opium made its way to the United States. In the 1860s, opioids were used to treat soldiers in the Civil War, and nearly 400,000 soldiers that were prescribed morphine later became addicted to it. In the late 1800s, over-the-counter availability increased, and Bayer brands began selling heroin for pain relief and coughs. In the early 1900s, Americans began crushing opioid pills to inhale them for pleasure, and then in 1914, the Harrison Narcotics Act made opioids available only by prescription to help limit recreational use. In the mid-1900s, opioids were only used for dying patients. And then in the 1970s, doctors started using nerve blocking operations and other methods to relieve chronic pains to avoid the use. And then in the late 1990s, pharmaceutical companies started reassuring the medical community that patients would not become addicted to the prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. I would say that at this point in the late 1990s, that's where our big crisis started to begin. And now in 2017, more than 47,000 Americans died as a result of an opioid overdose, including prescription opioids, heroin, and illicitly manufactured fentanyl, a powerful synthetic opioid. And this subsequently led to a widespread diversion and misuse of these medications before it became clear that they could indeed be highly addictive. Opioid overdose rates began to increase that same year, and an estimated 1.7 million people in the United States suffered from substance use disorders related to prescription opioid pain relievers, and 652,000 people suffered from a heroin use disorder. So what do we know? This issue has become a public health crisis with devastating consequences, including increases in opioid misuse and related overdoses, as well as the rising incidence of neonatal abstinence syndrome due to opioid use and misuse during pregnancy. The increase in injection drug use has also contributed to the spread of infectious diseases, including HIV and hepatitis C. As seen throughout the history of medicine, science can be an important part of the solution in resolving such a public health crisis. And if you look at the slide, it says roughly 21 to 29% of patients are prescribed opioids for chronic pain misuse them. Between 8 and 12% develop an opioid use disorder. An estimated 4 to 6% who misuse prescription opioids transition to heroin. About 80% of people who use heroin first misuse prescription opioids. And then an updated statistic is that among 38 states with prescription opioid overdose death data, 17 states saw a decline between 2017 and 2018, and none experienced a significant increase. So now a little closer to home. In Texas, opioid-involved overdose deaths totaled 1,402, a rate of 4.8 in 2018. Deaths involving synthetic opioids other than methadone, mainly fentanyl and fentanyl analogs, remain steady with 358, a rate of 1.2, and reported deaths in 2018. And then deaths involving heroin or prescription opioids also remain level with a respective 668, a rate of 2.3, and 547, a rate of 1.9 deaths in 2018. So what's being done? In response to the opioid crisis, the U.S. Department of Health and Human Services, or otherwise known as HHS, is focusing its efforts on 5 major priorities. Improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, and providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. The NIH, which is the National Institutes of Health, which is a component of HHS, is also the nation's leading medical research agency, helping solve the opioid crisis via discovering new and better ways to prevent opioid misuse, treat opioid use disorders, and then better pain management. In 2017, the NIH met with pharmaceutical companies and academic research centers to discuss safe, effective, non-addictive strategies to manage chronic pain, new and innovative medications and technologies to treat opioid use disorders, improved overdose prevention and reversal interventions to save lives and support recovery. And in 2018, the National RX Drug Abuse and Heroin Summit, the NIH director announced the launch of HEAL, which is helping to end addiction long-term initiative, an aggressive trans-agency effort to speed scientific solutions to stem the national opioid public health crisis. So common signs of use is the inability to control opioid use, uncontrollable cravings, drowsiness, changes in sleep habits, weight loss, frequent flu-like symptoms, decreased libido, lack of hygiene, changes in exercise habits, isolation from family or friends, stealing from family, friends, or businesses, and new financial difficulties. Treatment for opioid use disorders is available from medical professionals, and medications such as methadone, buprenorphine, or naltrexone paired with support programs can help people recover. So overdose prevention, improving the way opioids are prescribed through clinical practice guidelines can ensure patients have access to safer, more effective pain treatment while reducing the number of people who potentially misuse or overdose from these drugs. Reducing exposure to prescription opioids for situations where the risks of opioids outweigh the benefits is a crucial part of prevention. The CDC published guidelines for prescribing opioids for chronic pain to provide recommendations for prescribing opioid pain medication for patients 18 and older in primary care settings. Recommendations focus on the use of opioids in treating chronic pain, which is considered pain lasting longer than 3 months or past the time of normal tissue healing, which is also outside of active cancer treatment, palliative care, and end-of-life care. There are a variety of ways to help reduce exposure to opioids and to prevent opioid use disorders, such as prescription drug monitoring programs and then state prescription drug laws. Formulary management strategies and insurance programs such as prior authorization, quantity limits, and drug review also help. Academic detailing to educate providers about opioid prescribing guidelines and facilitating conversations with patients about the risks and benefits of pain treatment options. There are quality improvement programs in healthcare systems to increase implementation of recommended prescribing practices, patient education on the safe storage and disposal of prescription opioids, and then there's improved awareness and shared resources about the risks of prescription opioids and the cost of overdose on patients and families. To treat those with opioid use disorders, it's crucial to expand access to evidence-based treatments, including medication-assisted therapy, also known as MAT. MAT is a comprehensive way to address the needs of individuals that combines the use of medications and counseling and behavioral therapies. We can also expand the access and use of naloxone, a non-addictive life-saving drug that can reverse the effects of an opioid overdose when administered in time. Access to naloxone can be expanded through standing orders at pharmacies, distribution through local community-based organizations, access and use by law enforcement officials, and training for basic emergency medical service staff on how to administer the drug. So some signs and symptoms of acute overdose are your breathing will slow or absent. A person is not moving. You can hear gurgling sounds or snoring. Skin feels cold and clammy. Lips and nails are blue. A person might be choking. They can't be woken up. And then pupils are tiny. So what do you do if someone is overdosing? It might be hard to tell if a person is high or experiencing an overdose. If you aren't sure, it's best to treat it like an overdose. You could end up potentially saving a person's life. So immediately call 911. If you have access to naloxone, administer it immediately. Try to keep the person awake and breathing. Lay the person on their side to prevent choking, and stay with him or her until emergency workers arrive. Here at Sam Houston, we have a Good Sam policy, which is SHSU's Good Samaritan program. Sometimes when potentially harmful or dangerous situations occur that involve alcohol or drugs, people may be reluctant to call for help. This is often because of a fear that they can face consequences for something they shouldn't have been doing, such as drinking. With the Good Sam program, amnesty is guaranteed to anyone that is acting in the best interest of someone else. So if you ever feel that the safety or well-being of someone else is in danger, don't hesitate to make the call. So SHSU's policy is a student who, by preponderance of the evidence under these rules and regulations, is found to have illegally possessed, used, sold, or distributed any drug, narcotic, or controlled substance, whether the infraction is found to have occurred on or off campus, will have their housing contract terminated and will be referred immediately to the Office of Student Life for disciplinary action. Possession of drug paraphernalia will result in the termination of their housing contract and referral to the Dean of Students for disciplinary action. Any resident who has misused, abused, or has been under the influence of a particular drug or product, regardless of legality, with the intent purpose to become intoxicated or high, will be in violation of the Res Life drug policy and will be disciplined accordingly. Residence Life reserves the right to require students to be drug tested at the resident's cost based on the resident's involvement in the drug-related incident. Students should be aware that an amendment to the Family Rights and Privacy Act allows university officials the option to contact parents of students who are under 21 and are found to be in violation of SHSU policies and or laws the state of Texas concerning the possession, use, or sale of distribution of any drug, narcotic, or controlled substance. The Board of Regents and the administration of SHSU also support the national policy of the United States of America to stop the illicit use of drugs and the abuse of alcohol in our society. In keeping with the Drug-Free Schools and Communities Act, SHSU has adopted a drug-free workplace policy and implemented a drug awareness program to prevent the illicit use of drugs and the abuse of alcohol by students and employees. The SHSU drug-free workplace policy prohibits the unlawful possession, use, or distribution of drugs and alcohol by employees on university property or as any part of the university activity. The unlawful use, possession, or distribution of drugs or alcohol will result in a disciplinary penalty of disciplinary probation, demotion, suspension without pay, or termination depending upon the circumstances. The SHSU Drug Awareness Program is a 3-part program to inform employees about health risks involved in the use of illicit drugs and the abuse of alcohol, which often result in poor health and premature death. Help available for drug and alcohol counseling, treatment, and rehabilitation that is offered to all SHSU employees. Local sanctions, which include fines and/or imprisonment for violation of local, state, or federal drug laws. And SHSU is obligated to uphold laws which prohibit the possession, use, or distribution of controlled substances. Any employee who is found to be in violation of these laws will be dismissed and referred to the appropriate legal authority for prosecution. The SHSU Human Resources Department is the source of information and confidential assistance for any employee who is seeking help for drug or alcohol-related problems. You can contact the HR department located in the John W. Tomlinson Building at 1831 University Avenue, Suite 202, and their phone number is also listed below if you need additional information about this program. So that concludes today's Lunch and Learn over the opioid crisis. If you have questions, you can contact us at the Office of Health Promotion. Our phone number is 936-294-2653. You can email healthpromotion@shsu.edu. You can find us on Instagram at SHSU_OHP or Twitter at SHSU_OHP. If you would like to pop into our office, we are located in the Lee Drain Annex in Suite 111. And before